Hello, I'm Dr. Igor Simonov, and today I will continue the explanation how I use the pulse-guided acupuncture for treatment of the different conditions, and how I use the pulse map method, especially together with the theory of Wu Xing. Wu Xing is the theory of the 5 movements. Sometimes we explain it in very little bit different way, and sometimes when we come to some treatment of some condition or some diseases, we may find that we have not result as we expected, and sometimes treatment even fail. In reality, we just do not consider the real movement, one of these theory of Wu Xing. Here's the pulse map of patient with the chronic fatigue before and after. So this patient came with the chronic tiredness and the pain in her body. So she received the acupuncture treatment with according to Wu Xing method and the pulse-guided acupuncture. So again, I will explain that here we have the pulses of the different meridians or vessels. It's the lung, heart, pancreas, liver, right and left kidney, large intestine, small intestine, stomach, gallbladder, sanjiao or triple wormer, and the urinary bladder. So what we can see that in the pulse map of this patient, that she had the excess in the lung meridian, and we can see that the lung is on the level of liver. So actually movement in the lung meridian is the Wu movement according to Wu Xing theory. Here's a deficiency in the heart meridian on the level of the lung, the metal. So we can see that movement of the heart meridian is the metal. Here we have the excess in the spleen meridian, a pancreas meridian, and it's went to the level of the kidney, the water. So we can say that the movement according to Wu Xing, movement of the pancreas meridian is the water in our case. Here we have the liver meridian, the emptiness and the deficiency, and it's went to the level of the fire, the heart meridian. So we can say that according to Wu Xing, the movement in this meridian is the fire. And here's the kidney, right kidney, and the left kidney deficiency. So we can see it went to the level of the spleen, the earth, pancreas. So we can say that in this meridian, the movement which dominates in this meridian is the earth movement. And here's the Zan. Here's the Zan, and here's the full organs. So here's the large intestine in its place, a little bit deficiency in the small intestine, a little bit excess in the stomach meridian, but the rest, they are perfectly, the rest of the meridians, they're perfectly fine. So after the treatment of the pulse-guided acupuncture, patient straight after the treatment, and when she came back 1 week later, we found that actually this excess in the lung has decreased. The excess in the spleen was, pancreas was still as it was. Deficiency in the liver decreased, and deficiency in the kidney meridian has decreased too, and the patient, even after one treatment with this so serious condition, difficult for treatment as the chronic fatigue, started to feel better. So how treatment was provided? Here I will show you just the classical explanation of the Wu scene. So here we see the number 5, and the Wu and the scene is the two figures of two men walking to the opposite directions. And in the old Chinese we have here the fire, which produces the earth, earth produces the metal, metal produces the water produces the wood, and the wood produces the fire again. So usually it's we can find it in the this chart, like the heart, as if it has the movement of the fire, produces the spleen, a pancreas, the earth produces the metal, lung produces the kidney, water, kidney produces the liver, wood, and liver, wood produces the fire, heart. But in our case, as we saw that movements were different, for example, lung was movement of the wood, heart had the movement of the metal, spleen, a pancreas, has the movement of the water, and so on. Actually, in our chart will be like that. Liver, in our case, is the fire, produces the earth, which is the kidney in our case. Kidney produces the metal, which in our case is the heart. Heart, metal, produces the water, which in our case is the spleen and pancreas, and pancreas produces the wood, which in our case is the lung. So different meridians here, they are in excess are deficiencies. So for example, like the lung meridian and the spleen pancreas meridian, they're in red, they're in excess, and the meridians which with the black circle, they're in deficiency. So how we treat this? Of course, we use the to tonify, give the energy to the fire. We use the wood, which in our case is lung. So as lung has the movement of the wood, we use the first point, we'll say point number 11 on the lung, stimulating it to stimulate the liver. To stimulate the kidney, the earth in our case, we need to use the mother of the earth, in our case liver, and as the fire, so we use the fire point of the liver to stimulate the kidney, and to stimulate the metal, heart in our case, we use the kidney, and as is the earth point, so we use the number 3 of kidney meridian, point of the earth to stimulate the heart. To disperse the excess of the water and of the wood, we need to stimulate the son of the wood. So son of the wood is the liver. So in this case,